How we come to anterior triangle of neck. The anterior triangle of neck is bounded by the median line in the median plane, by the jugular notch in the lower part, anterior border of sternocleidomastoid laterally, base of the mandible, and the line joining the angle to the mastoid process above. So all this area is the anterior triangle of neck. This triangle is subdivided into 3.5 triangles on each side. Half is the submental triangle from the base of the mandible to the hyoid bone. It is actually enclosed between the two bellies of the anterior belly of the digastric muscles. The other triangle is the digastric triangle, bounded by the anterior belly and the posterior belly of digastric muscles, by the base of the mandible. The most important content of this triangle is the important submandibular salivary glands and the lymph nodes associated with the gland. The third triangle is the small muscular triangle, bounded by the anterior median line of the neck, the superior belly of the omohyoid muscle, and it is contents are the sternohyoid, superior belly of omohyoid, sternothyroid, and the thyrohyoid muscles. The biggest part of the anterior triangle is the carotid triangle. It is bounded by the posterior belly of digastric, supplemented by the stylohyoid muscle, by the superior belly of omohyoid, and the anterior border of the sternocleidomastoid muscle. The contents of this triangle are the common carotid artery, which divides in the triangle into a superficial external carotid and a deeply placed internal carotid arteries, the laterally placed internal jugular vein, and the vagus nerve in between the artery medially and the internal jugular vein laterally. The external carotid artery gives number of branches. Some of them are seen in this triangle. The first one is the superior thyroid artery, which supplies the thyroid gland. The next is the lingual artery, and the third is the facial artery, which has a course in relation to the gland, and then it runs on the face. The vagus nerve gives important branch, the superior laryngeal nerve, which divides into an internal laryngeal nerve and an external laryngeal nerve. Another nerve seen on the left side arising from the thorax is the recurrent laryngeal nerve, which also supplies the muscles in relation to the larynx.